So now we'll go to the next vein, which will look at its clinical anatomy. And this is what is known as a common iliac vein. So first of all, we'll try to identify the common iliac vein. So you will actually see the common iliac vein. So it's kind of like in the abdomen, it's kind of like close to the pelvis. Okay. Common iliac vein. So look at some of its clinical anatomy. So the first one we're looking at is what deep vein thrombosis. So deep vein thrombosis is when you're not having clots in veins. There's a frequent location for what iliofemoral deep vein thrombosis, which carries higher risks of pulmonary embolism and post-thrombotic syndromes compared to the distal deep vein thrombosis. So risk factors is if you have been in one place for a very long time without moving, you have undergone pelvic surgeries, cancers are spreading in you, you are pregnant, and all of that. So there's a lot of swelling, there's a lot of pain, there's a lot of discoloration of the leg. Then how about the May-Thurner syndrome? This is the May-Thurner syndrome. Okay. So May-Thurner syndrome just have to do with narrowing left iliac vein, okay, usually by pressure from the right iliac artery. So let's look at it. It's just a compression of the left iliac vein because of the iliac artery, okay. The cause is because of chronic pulsatile compressions. Like there's a whole lot of pressure, in the artery. So as the artery is lying on top of the vein suffers the effect. So that's what we have. Surgical relevance is if you are doing any pelvic and vascular surgeries around that place, lymphadenectomy and all of that, you have to know that was such a vein actually exists there. Then vascular reconstruction is used in venous bypass grafting. Okay, it can also be accessed for dialysis. Okay, and all of that. It's also imaged for all those ultrasound, CT venography, MR venography, intravascular ultrasound can also be used, and also some conventional venography.